Good afternoon, everybody. Thank you all for joining today's information session on the request for proposals that we recently launched for manufacturers of magnesium sulfate. I'd like to express a very warm welcome also on behalf of our project partners, in particular the Clinton Health Access Initiative. My name is Petra Proctor. I'm speaking on behalf of Concept Foundation, and I'm a senior program manager at Concept Foundation and the operational manager for our work in this project, which we'll explain a little bit more in due course. We're just sharing our slides. You should hopefully see them all up on the screen. Before I go any further, just a few housekeeping points. We welcome questions throughout the session, so please use the Q&A function or the chat, whichever you're most comfortable with. We also encourage those of you who are happy to share your name, the company that you're coming from, and where you are dialing in from today in the chat. For the next half an hour or so, I'm going to run through the slides. The slides that we've loaded up, you can actually flick forward and backwards. There's quite a lot of information on a lot of the slides, so feel free to scan forward and have a look. But just note that you can always press, there's a button that allows you to sync back to the slide that I am on. As mentioned in the information regarding this session, we will be sharing the recording of this session and also the slides on the main webpage that we've launched the RFP from on our website, and we'll also post about that on LinkedIn. So you should be able to access the recording or share it with any colleagues that you wish to, or at least access the slides as you wish. So now that we've covered those points, I'm going to briefly run through our agenda for the session before I hand over to one of my colleagues who's going to do some opening remarks to set the scene and frame the session a little bit more. So before doing so, as I said, our agenda for today is to share briefly a little bit more about Concept Foundation for those of you that are new to our organization, and also give an overview of the Supreme Secure project, under which we're launching this request for proposals. We'll then walk through very practically what the request for proposals is all about, what we're looking for, particularly in terms of collaboration with our manufacturing partners. We'll also touch on what a good proposal looks like, how we will be evaluating the proposals, and then we'll finish on some key dates over the next couple of months, few months even, that we'd like to call out for those of you who are interested to submit a proposal. As I said, we expect this to take about half an hour. So once we finish that, we'll be looking at the chat and the Q&A to see if there's any specific questions from you all. And we'll run through those questions, but we'll also be posting anonymizing and posting questions as they come over the next few weeks that will also incorporate those that come into this session, as there'll be manufacturers that haven't been able to join this session or may want to review later. So without further ado, I'm going to hand over to Alessandra Tomasini. She is our responsible pharmacist and the technical lead on this project. And she's going to share a few words about the broader public health context and frame things before we jump in. Over to you, Alessandra.
Thank you, Petra. Good afternoon, and thank you all for joining us today. On behalf of Concept Foundation, CHAI, and our Supreme Security partners, it's a real pleasure to welcome such a strong group of manufacturers to this information section. Your presence today is critical and very intentional, because ultimately, the success of this initiative ranges not only on innovation or policy, but on the ability to manufacture and deliver quality-assured products at scale, sustainably and affordably. Let me start by framing why this matters. Despite decades of progress in maternal and newborn health, the global burden remains unacceptably high. Each year, nearly 300,000 women die from complications related to pregnancy and childbirth, alongside millions of newborns' deaths and stillbirths, the vast majority occurring in low and middle-income countries. Among the leading causes of this death are conditions we know how to prevent and treat, particularly preeclampsia and maternal anemia. Preeclampsia alone is responsible for approximately 46,000 maternal deaths and over 500,000 neonatal deaths and stillbirths every year. And yet, the tools to prevent and manage these conditions are often underused, inconsistently available, or not fit for purpose in settings where they are needed most. There is where you come in. From a manufacturer's perspective, this is not simply a public health challenge. It is fundamentally a market challenge, a market where demand exists, but is fragmented. Guidance exists, but is inconsistently implemented. Products exist, but are not always quality assured, accessible, or affordable at scale. And where in some cases the absence of right formulations, the right stability profiles, or the right pricing models directly translates into preventable death. The security project was designed specifically to address these gaps. Over the next 4 years, Secure, an Unitaid-funded multi-partner initiative, will work across the entire ecosystem to unlock access to essential maternal health products. This includes generating evidence, supporting country adoption, shaping demand, and critically working directly with manufacturers to overcome supply-side barriers. Our focus is not only on innovation, but on ensuring that proven life-saving interventions actually reach the woman who needed them. On such intervention, and the focus of today's discussion is magnesium sulfate for the treatment of preeclampsia. Although magnesium sulfate is the first-line primary treatment for eclampsia and severe preeclampsia, its administration is lengthy, complex, and presents logistical and resource challenges in low-resource settings. We know that magnesium sulfate is safe and effective, yet in many low and middle-income country settings, its use remains limited. Why? Because even for a product as well known as magnesium sulfate, there are still critical gaps. While there is some availability across low and middle income countries, prevalence of non-quality assured product is high. Dosing recommendations differ between guidelines or are not specifically mentioned, and cost of goods is relatively high in comparison to other PE therapeutics. So today's sections and the RFP we are launching is not about introducing a new molecule. It's about something equally important, getting the basics right at scale for populations that need it most. And we are very deliberately looking for partners who share that ambition. What we are offering through Secure is not a transactional procurement exercise. It is a collaborative model, one that combines technical assistance across product development, regulatory strategy and quality system, market intelligence and country insight to inform your commercial decisions, and potentially financial support linked to key milestones to help de-risk investment. In return, we are looking for manufacturers who are ready to engage in long-term partnership with clear commitment to quality assured production, sustainable and equitable pricing, and reliable supply to low and middle income countries' markets. Because at the end of the day, access is not achieved through one actor alone. It requires alignment across the entire value chain, from R&D and manufacturing, through regulation and procurement, all the way to the point of care. And if we get that alignment right, the impact is substantial. Expanding access to interventions like magnesium sulfate is not just about improving clinical outcomes. It's about reducing strain on health systems, avoiding costly implication, and creating healthier, more productive societies. From a manufacturer perspective, this is also about building sustainable markets, ones that are predictable, scalable, and aligned with global health priorities. So today is really the starting point of that conversation. Over the next hour, we will walk you through the broader Secure initiative, the specifics of the RFP for magnesium sulfate, what collaboration would look like in practice, and how your organization can engage in this opportunity. We strongly encourage you to think about this not just as a bid, but as a strategic partnership opportunity, one where your capabilities can directly contribute to saving lives at scale. Thank you again for your time and for your interest in this work. We look forward to the discussion. Thank you, Petra.
Thank you so much, Alessandra, for those excellent opening remarks and really setting the scene for the next for our session. So as I mentioned, we're going to briefly touch on an introduction to Concept Foundation, recognizing that some of you may be new to us as an organization. So we are an international not-for-profit organization. We have offices in Geneva and Bangkok, and we're currently working on opening a hub in Nairobi, Kenya. We were established in 1989, so we are over 35 years old. And at the time, we were established as part of a UN multi-agency program focused on research and development in human reproduction. And since 2004, we've maintained a formal collaboration agreement with the World Health Organization. And can I just check that we've moved to the next slide? Sorry, I've moved forward in my own navigation. So if we can move to the slide on Concept Foundation. Excellent. Thank you. So at Concept Foundation, our roots very much lie in sexual and reproductive health, and within that, maternal health is core to what we do. Our core mission is to accelerate innovation and improve equitable access to quality assured, affordable sexual and reproductive health medicines and technologies for women and girls globally. I'd say what distinguishes our approach is that we work across the entire product life cycle, from early stage research and development to manufacturing, regulatory approvals, and also supporting market access downstream. And we hold a lot of institutional knowledge around specific products that we've gained over the years. So we also support product development and product improvement depending on the project. This means that we don't just identify gaps, we actively support manufacturers, providing technical support, working with them at their sites, with their teams, overcoming technical, regulatory, and commercial barriers. So our manufacturing market access team works closely with partners to ensure that the essential medicines that we're focusing on are not only developed, but are sustainably available in low resource settings. You can move to the next slide, Caroline. Thank you. So Supreme Secure. Supreme and Secure are both acronyms. You can see at the top of the slide there what they stand for. Supreme is sustained uptake of products for preeclampsia and maternal anemia. So as Alessandra mentioned, the big focus of this work is to really make change in these two particular pregnancy-related conditions. Secure stands for sustaining equitable care and universal resources for preeclampsia and anemia. So you can see the word sustained is coming out there twice. So it's really critical for this work to go beyond the 4 years of its duration. We want to see systemic change and bring about that change across multiple outputs. This program is funded by Unitaid. And it's running from 2026. We launched in January of this year to 2029, so over 4 years, as I mentioned. The focus countries for this work are Ghana, Malawi, Tanzania, Senegal, and Kenya. And the program is built across four core pillars. You can see these on the left of the slide. The first pillar is focusing on demand, on generating, evidence to address product-specific knowledge gaps to really guide our work and support market entry and introduction of new technologies. And I'll also mention that this project is not just focusing on medicines, it's also focusing on diagnostic tools. You can see on the right of the slide the product scope for this program. So please take note of that. If you are a manufacturer of any of the other products that you see in the list, Yesterday, we held our informational session for aspirin, and I think some of you were also on that session. We've currently launched RFPs for magnesium sulfate and aspirin, but later this year, around 3 months from now, we'll be launching RFPs for four antihypertensives, hydralazine, labetalol, nifedipine, and methyl-dopa. And also Chai, our partner, will be launching an RFP very soon for ferrous carboxymaltose or IV iron. So those are the therapeutics in scope. We're also working on a range of diagnostic tools for preeclampsia and maternal anemia as well. Um, the only other thing I'll say on this project is that as Alessandra mentioned, magnesium sulfate is critical and a critical intervention for preeclampsia, so it's a primary focus of the program, and this is rooted in it being a WHO recommended essential life-saving medicine, and but still being a product and a medicine that is facing significant access and supply challenges in many settings. So this request for proposals is really focused on identifying manufacturing partners to work with across these medicines. You can go to the next slide. So as mentioned, we are searching for manufacturing partners, and again, I'll echo what Alessandra said. We're not looking for partners to work with on, a transactional purchase order. We're looking for longer term partners to work with, to collaborate with, together to address the supply gaps that are existing in the target countries. Also recognizing that, supply will probably need to go beyond these countries, and we'll be needing to work on the commercial plans for market entry with a larger country scope in mind, but also stressing that the focus of this particular project are those 5 implementation countries I mentioned. So under this RFP, very practically, we're specifically targeting manufacturers of magnesium sulfate injection with a concentration of 0.5 grams per mil. Presented in either 2 ml or 10 ml ampules. We are looking for quality assured manufacturers, so manufacturers that have products that are either WHO pre-qualified or are approved by a WHO listed authority. However, we are also open to receiving proposals from manufacturers that are close to achieving these approvals or have a quite a well-defined product development pathway and timeline to achieve this goal. So we're not completely closing ourselves off to only receiving existing pre-qualified or approved WLA approved products. As I've mentioned, just the rationale behind focusing on magnesium sulfate is for its clinical use for prevention and treatment of preeclampsia. As mentioned, a key focus of this RFP and this collaboration is not just quality, but also affordability. So we're not just looking for technically capable manufacturers and partners, also those who can deliver a sustainable supply with access-focused pricing. The RFP itself consists of 2 standalone documents. The RFP instructions are in a PDF document that includes 3 forms that need to be signed by manufacturers, filled out and signed by manufacturers when they submit their proposal. And then there is also an Excel questionnaire that needs to be downloaded and completed by all manufacturers submitting a proposal. Both of these, so the PDF forms within the broader RFP document and the questionnaire have to be completed as part of your submission. You can go to the next slide. So as I've touched on collaboration already, but we really want to stress to our candidate manufacturers that at the heart of this initiative is collaboration. This is not a transactional procurement. While of course supply to target markets is absolutely the end goal and registering product in those markets, we really do see this as a partnership. So successful collaboration will depend on open and transparent communication, building mutual trust, an active exchange of information, and a strong team-based approach. We really see this as both sides meaning the partners running the Supreme Secure program and our manufacturing partners engaging proactively and aligning around a shared goal, which is to expand access to life-saving maternal health products. You can go to the next slide. So drilling down from that, manufacturers, what manufacturers can expect from us is those that are selected will receive several forms of targeted support from Concept Foundation and also from CHAI. The first being around technical assistance. So we have built in time and funds to be able to provide technical assistance that's targeted and bespoke for each manufacturer. So this could include late stage product development, which could include formulation optimization and analytical method development, right through to regulatory strategy. Again, I must stress that we're looking at shorter timelines, so we won't be able to consider those manufacturers under this program at least a longer timeline. But that doesn't mean that we could potentially look at other ways to collaborate in future. We will also be providing support for dossier preparation. For submission either to WHO PQ or WHO listed authority, and for submission to country registrations as well, so national regulatory agencies. The second form of technical support that manufacturers will receive through collaborating on this program is market intelligence. The big question we are already receiving from a lot of candidate manufacturers is what are the volumes? What's the expected demand? We will be working hard to provide insights into target country markets, and this is actually an activity that CHAI will be leading on, as they have a very strong footprint in all of the target markets in terms of country offices and engagement across different parts of the market, sectors of the market. So we'll be looking to understand more around demand dynamics and access pathways and facilitate connections with key stakeholders and partners between manufacturers. The third area of support is quite specific around provision of financial support. This will be milestone linked, and it is undefined right now as to how much financial support we can provide to manufacturers. We don't have millions that we can provide, but we do have some small buckets of funds that we can utilize to support things like registration fees, PQ fees, or other financial needs that could advance manufacturers towards being able to meet access goals. So overall, this package of support is really designed to de-risk development and accelerate access. So you can go to the next slide, where I'm going to just walk through what, in return for this support, our expectations for manufacturers are pretty clear, and I think I've already touched on them in general terms, but specifically and quite more in the immediate term, we will be looking to do on-site assessments of selected manufacturers and undertake gap analyses where needed. We expect manufacturers to be open to participating in a financial forensic audit. And we also will be looking to start discussions early on to collaborate closely on pricing strategies and access pricing in line with regulatory pathways as well. So as we've said, this project is going to run for 3 to 4 years. So we're looking for manufacturers to designate dedicated resources and engagement, communicate transparently in a timely and respectful way, and demonstrate a clear commitment to supporting sustainable supply in target low and middle income country markets. So again, we see this very much as a long-term partnership, and success will depend on alignment and commitment from both sides. So you can go to the next slide. So drilling down a bit further into the actual RFP itself, as I've mentioned, the submission, we've tried to keep it as simple as possible, but also ensuring we're collecting the right information that we need. So the deadline for submissions is midnight UTC on Friday, June the 5th. There are a few dates that I'll go through shortly between now and then. But the final proposal package that you submit should be those three completed signs: a signed declaration, a signed quality audit agreement, and a signed financial forensics audit forms A, B, and C, and also your completed RFP questionnaire. RFP proposals should be submitted to our dedicated RFP email address, which you can see on the slide there, and is also included in the RFP document. Um, and we request that the RFP documents are all submitted in a single email, and we will not be considering late submissions. So please keep that in mind and plan accordingly. So the overall process that we're going to be following is we'll be undertaking initial screening of proposals. We'll then be shortlisting, we'll be shortlisting and inviting a shortlist of manufacturers to join a one-to-one discussion. The one-to-one meetings will include Concept Foundation and will also be observed by a member of an independent review panel that will be ensuring that the overall RFP process is fair and transparent. Um, Following the one-to-one meeting, manufacturers will have an opportunity to revise their proposals, and the deadline for submitting the revised proposals will be the 31st of July. Following this, we will be progressing our final evaluation and selection and moving forward with a selected manufacturer or manufacturers. This question already came up in yesterday's info session as to whether we'll be working with one or more. And right now, we honestly can't say. We need to see, obviously, what comes in through the RFP process and how that is starting to align with some of the market intelligence that the CHAI team have been gathering around whether we think one or more manufacturers would be needed to ensure adequate supply for the target product. So you can go to the next slide. So a little bit more on the evaluation process that we'll be undertaking and also the criteria that we'll be evaluating proposals against. We will be establishing a dedicated evaluation committee within Concept Foundation that will comprise a minimum of three team members, two of which will be technical and one from the program side. This committee will be looking at both the technical and financial criteria. On the technical side, we will be assessing manufacturers for their capability and capacity. Also, for those where this is relevant, product development plans, regulatory strategy, and bioequivalence approach. This all comes up in the questionnaire. So for those of you who haven't yet looked at the questionnaire, you'll see a lot of the questions, all of the questions are directed to allow us to evaluate on this level. We're also looking for any prior experience or track record of registering products in the target markets, and also your quality track record, and also again proposed timelines against product development and other key factors. On the financial side, we will be looking at proposed access pricing, supply conditions, including minimum order sizes, and we will also be open to manufacturers providing a pricing schedule related to procurement volumes or economies of scale. And as we've said, the goal of this RFP is to identify manufacturers that are both able to deliver high quality products and also sustainable, affordable access pricing. So you can move to the next slide, which I think is my final slide. Yes. So we'll just conclude on calling out some of the key dates that you need to keep in mind if you're planning to submit a proposal. You have until the 26th of May to submit any questions that you may have that you may discuss internally and come up with your teams. You're very welcome to ask any question, but we please stress that you submit those questions to the RFP, the dedicated RFP email address. We won't be able to answer questions outside of this channel. And we won't be answering any questions by phone or WhatsApp. Everything needs to be done by email. And this again is just to ensure a really fair and transparent process and that we can document everything for our independent review panel if needed. On the 29th of May, on Friday, a few days after that Q&A deadline, we'll be publicly posting all questions that have been asked, anonymized and collated, so that all manufacturers have access to the same information and the same answers, and that we're not sort of providing any preferential information to certain manufacturers. As already mentioned, the deadline for proposals is the 5th of June. And I've already outlined a little bit the forward process from that point on, but to put some dates to that information, we expect to be notifying shortlisted manufacturers by early July, so the 3rd of July. Following that, we'll be inviting those shortlisted manufacturers to attend one-to-one meetings. Those meetings will be scheduled over a 2-week period between the 6th and the 17th of July, and with the goal of asking manufacturers to submit their revised proposals by the 31st of July. We'll then be finalizing our evaluation and selection as mentioned, and aiming to notify selected manufacturers the selected manufacturer or manufacturers by mid-August, latest early September. Following on from that, we will be rapidly working closely with the selected manufacturer to develop a supply agreement and have those agreements signed by October, which gives us then at least 2 to 3 years to work closely with selected manufacturers on all the activities that we've described in this session. All of these timelines are indicative and could change. We hope they won't, but if they do, we'll be letting bidders know, of course. And I think you can go to the final slide, Caroline. Yeah, okay. So the other thing I'll mention is any questions that come up in this session we'll add to our Q&A document. And we also wanted to mention that Unitaid and consortium partners will not be able to respond to RFP-related inquiries. These all have to come through Concept Foundation and through our RFP TX email address. So with that, I think I can conclude the information sharing. We're now going to open up the floor, the chat and the Q&A function. I don't know if I haven't been looking, so I'm not sure if we already have questions. Looks
Yeah,
like
we have a
do.
question in the chat.
Great, thank you, Caroline.
Yeah, from Jennifer. She'd like to confirm that the financial assistance does not include R&D stage.
So it's a good question. I think largely speaking, no, because by default, we would expect the timelines associated with that stage of development to be too long for what we're looking for. I think it really depends on how rapidly manufacturers are able to progress that R&D stage. So at this point, I think what I would direct you to do, Jennifer, is to send this question into our email address, but provide a little more detail if you can around what those timelines might look like. The other thing you could do is submit a proposal and just include as much information as you can in the questionnaire. The questionnaire is designed to allow you to answer specifically, but also we encourage manufacturers that can't answer, don't have specific information right now, but to still share information that can help inform our evaluation and our review. So sharing more about what that timeline could look like, how quickly you could be reaching the point of being able to submit to PQ, for example, knowing that you would also potentially be getting technical support from Concept Foundation on that process. But I'll stress again that timelines are really important on this project. So we won't be able to work with manufacturers that say need, over a year or even potentially less than that to reach a stage of being able to get their product approved. So I hope that's helpful. I know it's not a direct answer, it's not a yes or a no, but we'd really need to look at each case and make a decision from the information that's provided.
Great. We have another question in the chat from Jim Lu. So in the marketing authorization holder system, are registrants specifically entities that do not possess manufacturing capabilities, such as R&D institutions, research institutions, or sales companies, eligible to participate in this project and submit proposals?
Okay, so if I'm understanding correctly, Jim, this would be in the case where, say, you represent a market authorization holder, you're able to hold the market authorization and you're in partnership with an entity that makes the product. I think at this stage, we encourage submission of proposals, but we would need to be able to access all necessary information about that product, and we would need to assess that relationship as well. So at this stage, it's a great question, and I think it's something that we would need to discuss further internally as well. But at this stage, I think, yes, we would welcome proposals as long as all necessary information that we would need to assess quality and ensure that there is that we're able to sign a suitable access supply agreement with access terms, as I've mentioned. As long as that is feasible, then I think potentially we could be open to that. The key piece is that product can be registered alongside, obviously, the central components that we're focusing on, quality and affordability. So I hope that answers your question.
Yeah, we have two questions from Feseha. So question one, can you provide indicative annual demand volumes for the 5 target countries? And question two, is Ethiopia eligible? It's not listed among the 5 target countries.
Okay, so I'll take the second question first. We need, so manufacturers have to be willing and able and focused on registering products in the 5 target countries. That is a non-negotiable. So that doesn't necessarily mean that we would discourage a manufacturer from making the same product or products available in Ethiopia. Absolutely not. And I think the more we can see this work go beyond these 5 countries is only a positive thing. But yeah, I think from a target country standpoint, we need to see that the 5 target countries can be in scope and prioritized over the next between now and 2029. On indicative annual demand volumes, this is a great question and it's come up many times already. We're actively working with Chai on getting some ballpark figures, I should say, around the estimated annual demand volumes. We plan to share more of this information later on in the process. So if a manufacturer is shortlisted, most likely during the one-to-one meetings is when we'll be sharing more information on this. So I think we can reassure proponents, manufacturers that are planning to submit proposals, that they won't be going into this blindly at all. We'll be working closely with them to better understand the potential volumes and how to define a commercial pathway that works on both sides. This isn't obviously just about ensuring the lowest possible price for the best quality. It's also about making commercial sense for the manufacturing partners. So we'll be keeping that central to our thinking and our planning. And again, that's why collaboration is going to be really important. So as of today, it's very difficult to quantify these markets for lots of reasons. They're quite fragmented markets. The products are supplied through different channels, different procurement pathways. So a primary focus of this project is also to start to address those issues as well, in line with bringing new products into markets. So ensuring that there's better visibility of the market, that also downstream we're seeing more pregnant women presenting at antenatal care, there being better visibility at the facility level as to what the need is, and that translating up to the right parts of the supply chain so that there can be better supply planning, better reduction in stockouts and better visibility overall so that manufacturers can also have a level of comfort as they plan their supply to these countries. So I know that's not a specific number that I can shout out right now, but hopefully it's enough reassurance for you to know that we'll be taking this piece very seriously and it will be an integrated part of the program going forward. So I see some more questions. So Caroline, I'm able to see the chat now, so I'm happy to go through the next questions that have just come in.
Great.
So we'll start with the first question around an indication of the scale of financial incentives available or the types of costs that milestone payments are typically designed to cover. So that's a great question. Again, I think we'll be discussing this in more detail with shortlisted manufacturers. But as I mentioned, we don't have millions. This isn't a large investment in R&D or long-term product development. Going back to Alessandra's opening remarks, the tools and the medicines for preeclampsia and maternal anemia exist, particularly for preeclampsia. They're a lot of well-established medicines. It's really about unlocking the supply side barriers that are currently preventing these countries from having access to high quality, affordable medicines. So the way we've designed the financial incentives is to support, as I said, the support specific payments around registration fees across the target country markets. PQ fees as well. And to access these funds, we'll be working with, as I mentioned, milestone linked payments. So manufacturers won't be able to access the funds until they've met certain milestones that we'll be agreeing with them in their supply agreement. So for example, if a manufacturer is very close to submitting their magnesium sulfate to pre-qualification and they've got to finalize the dossier, that collaboration could look like we work closely with the manufacturer over a few months to rapidly finalize the dossier, get it into PQ, and support them to go through the process. And then as they reach certain milestones in that process, they would have access to funds. And the first milestone in that example would be submission of the dossier would then unlock support on PQ fees. That's just an example, and I can't guarantee that that is what it would look like, but hopefully that's illustrative enough to give you a better indication of the scale and the type of support and how it would link to milestones. In terms of the reference range for target access pricing, another great question and something we'll be working closely with manufacturers on. We're, as I said, actively seeking information and intel from the markets of focus, and we'll hopefully be able to share this information with our shortlisted manufacturers, as it's quite challenging right now to be concrete about what the specific pricing could be, but we'll be working towards sharing a range, as you've mentioned, so that we can start to put that into our target access pricing thinking and how we work together with manufacturers on this. The third question, the RFP lists WHO PQSRA as qualifying and WLA qualifying regulatory pathways. So yes, for magnesium sulfate, if you have an approval from a WHO listed authority country like Australia or Singapore, yes, this would be considered equivalent to SRA and it would be meeting evaluation criteria. So yes is the answer to that question. On the question on NDAs, yes, we are very happy to sign non-disclosure agreements with manufacturers. So we are working on the sequencing of this, but I think we can, if it's preferred by manufacturers to sign an NDA beforehand, we can work towards that, or we can aim to sign an NDA in parallel with receiving the proposal documents. You are welcome. Sorry, I'm just seeing the thanks in the chat. hopefully the information I'm sharing is helpful and is giving everyone a bit more context and detail to what we're expecting. As I said, no, any big or small question is welcome. So following this session, if you still have questions, if you want to understand more, we've allowed several, well, not several, but a few weeks for you to get your questions in. So please take the time to think them through and don't feel like don't be shy in sharing them with us on the email address. I'm going to pause there and see if there are any more questions coming in. And again, as I said, we will be taking all of these questions that have come up today and including them in our Q&A document. So you'll be able to refer back as well. Yeah, I'm just seeing the one more question. So regional, so on clarifying what regional means in this context, absolutely. So in this context, it will mean the African region because the target countries are in Africa. And there is also generally quite strong interest in the public health and donor communities to establish a better a more advanced manufacturing industry on the African continent. And so we will be considering manufacturers located in African countries. And again, they will be assessed in the same way that all other manufacturers will be. We didn't want to restrict the RFP in that way. So that's what we're referring to. And yes, specifically Africa. And no, I wouldn't say sub-Saharan Africa specifically. We would welcome proposals from any manufacturer located on the African continent. Are there any more questions from participants? We'll give it one more minute. Okay, then I think we can move towards closing. On behalf of Concept Foundation, Chai, the broader consortium working on this project and Unitaid, I'd like to thank you all for joining today's session and for showing your interest. We look forward to hearing from you, whether it's through the RFP email address or directly from a proposal you plan to submit. And we look forward to hopefully working with you closely in future. Thank you all again. I wish everyone a wonderful rest of your day or evening, and we look forward to hearing from you.